Well, welcome back to our third talk during week 2 on using models as roadmaps for transforming current practice and achieving better states of affairs than the ones we have today in our current experience. And so as we've talked about these models of transformation, in our first 2 sessions this week, we looked at the preconditions using the model for sustained transformation, as well as the systematic process. We covered each of those in turn. And now in this talk, we're going to continue that discussion of our roadmaps, building on what we've looked at in sustained transformation model, but adding Melnick's evidence-based practice model. So the main purpose of our time today is to overview her model of evidence-based practice and highlight some of the first initial steps so that you can understand it from a 360-degree view and begin to apply it as we move forward in the course. So let's dive in together. As we've talked about, the crucial first step in this entire transformation process is having a very clear sense of the goal that we're moving toward. And so you see with these 2 soccer players, as they go to kick the ball, if they don't have a sense of where they're headed, they're unlikely to get there. So our time together in DNP Project 1 is really focused on developing and building your skills in order to transform practice. So as we do that, we're going to work explicitly on some of the gaps between what we know from science and research and what we do in practice or policy or program design. So let's take a look at Melnick's evidence-based practice model. It has 7 steps, and the first step that she talks about is creating a spirit of inquiry. And the key idea here is that if you're in an organization or an institution that doesn't have a hunger to know and doesn't have a desire to do things better tomorrow than we do today, that finding the best evidence and getting it into practice is unlikely to have significant traction. We have to have individual minds that are thinking about how to improve in an informed way, but we also have to have a culture, an organizational culture, a unit culture, a hospital culture, a facility culture that is willing to ask the question, how do we do things better? So in her first chapter, she talks about creating that spirit. And the second piece is asking a clinical question, policy question, implementation question, population health question, whatever particular context you're working in, but asking that question in a structured PICO format. And the reason for that format is it enables us to take a very complex issue and narrow it down into something that we can go to the research literature and get information on and begin to sort through that information and distill it into practice. So what I'd like to do is walk through this PICO format with you, give you a few examples for you to think about framing your own practice issue in this format. So PICO format, it's very simply patient or population, intervention, comparison, outcome, and timing. And not every PICO question and every situation has all 5 of these elements, but in general, most situations need these 5. So let's walk through what they are by way of example. So in our first statement, we're going to look at what some of your colleagues have addressed with community-acquired pneumonia excess readmissions. So in the United States, Congress created legislation to penalize hospital facilities that have a higher proportion of patients who are readmitted within 30 days for certain key conditions like congestive heart failure and community-acquired pneumonia. So we're going to look at community-acquired pneumonia specifically in this example. So among hospitals in the 50 United States who manage Medicare patients with community-acquired pneumonia, so that's our P, that's our patient or population. You can see here we're not talking about the patients who receive care, we're talking about the facilities. And that's because of what data we have available to us from the Centers for Medicare and Medicaid. It's at the facility level, not at the individual level. So our data set is helping to inform how we're defining our PICO question. And that's true in any situation. Some of the practicalities of your organization, of your individual skill set, of the team that you're working with will impact the way that you craft your PICO question to guide your literature search and your transformation process. So here's our P, the hospitals in the 50 United States with Medicare patients. Now here's our intervention. So we're trying to compare two things. Does implementing discharge processes, such as patient teaching and care plan transmission, to outside primary care clinicians? So those are two key indicators in Medicare's database on hospital-based care. So we have access to that information for about 4,000 hospitals nationally, freely available through CMS. So we can look at those two process indicators and see how does having those clinical processes compared to limited implementation of those processes decrease a facility's 30-day community-acquired pneumonia readmission ratio. So that's, again, a number that's defined by CMS. You can look at some of their data reports on how that excess is statistically defined, which is beyond the scope of what we're focusing on today. But the key idea here is that we're comparing high implementation of these discharge processes to limited implementation and seeing if it has an impact on this outcome of patients returning to the facility for care within 30 days. And the timing, we're going to limit it to the calendar year 2014, which is the calendar year that we have data on most recently from CMS. So here's our PICO statement written as a sentence, but I've identified here in yellow each of the 5 elements. Sometimes starting with the sentence isn't the easiest way to go, but it's more helpful to break it into your PICOT categories and respond to each of them in a tabular form, and then create your statement. So these are the same concepts, but in the tabular form. Now, let's take a look at a second example of that in a different context. So here we're going to look at HIV-positive adolescent patients at an HIV-focused clinic in East Africa. So at this clinic, we'll call Clinic C, we've noticed that adolescent patients have a low proportion of adherence to their antiretroviral medication as measured by pill counts. So this facility has identified low adherence to their ART regimen as a key problem, and they're working on trying to define how to improve that adherence. So this is a model clinical center, but it's in a low and middle income country context with constrained resources. So they want to test whether the evidence-based intervention of motivational interviewing led by a social worker can increase adherence. And they're going to try this at 3 sequential visits when the patient comes back for routine care, and they'll try group-based therapy using motivational interviewing for 15 minutes intensive periods. So that's what they've scoured the literature and found as an evidence-based strategy. They're trying to customize it using group therapy in a time-limited way because of the limitations at this facility of giving individual-based care. And they want to compare that to the standard of care, which at present is the primary care clinician, which is a physician or a clinical officer who is the equivalent of a nurse practitioner. They may offer adherence messages or counseling for that patient if they see that that patient has missed visits or see the pill count from the social worker indicating that a few of the medications have been taken, but it's dependent on the primary care clinician to identify the need and then to act. And so that's the standard practice currently, and they want to compare these two approaches to see if adherence within this whole cohort of adolescents who received motivational interviewing will increase their adherence by 30% or more when you compare the baseline before the program to after the program. So that's the outcome measure. They're doing increased medication adherence, but they're not doing it at the individual level, comparing where you started individually and where you ended up individually. They're measuring it at the cohort level, because that's a data measure that's more practical and feasible in a low and middle income context that doesn't have access to researchers or staff to do all of these measurements. And then the timing is focused on a 6-month period between July and December. So they're going to roll out these motivational interviewing sessions over 6 months, but the hope is that in that period they'll capture the majority of this adolescent population who has low adherence at present. So even though the intervention itself only is over the course of 3 visits, which would probably be the equivalent of 3 months, they're going to run the intervention for 6 to catch people who may have been lost to follow-up or missing from care. So that's how you would define that PICO question using the grid. Now I'd like you to take a minute to pause the video, and I want you to write a PICO question in sentence format and then come back and join us. So hopefully you've had a chance to write that PICO question, and I'd encourage you to share that with your colleagues and compare how you're structuring your PICO question so you can begin to develop this skill if you don't already have it. Because again, this is a key bottleneck for designing your intervention process for your DMP project and for creating and finding evidence-based interventions and beginning to get them into practices. We have to define the issue and the problem well. So this is one tool. So that was just step 1 of Melnick's model. We start with a spirit of inquiry. We're asking questions. How can things be better than they are today? We move to step number 1, where we're framing our question in a very precise structured format, the PICO format. And now in step 2, we're going to find the best available evidence to answer that question. And so chapter 3 in your text does a great job of outlining that in a very step-by-step format, talking about what databases are available to locate information, what databases are best suited for population health, clinical-based nursing intervention, policy work, medical science research. So there are different databases that you could tap into depending on your particular practice issue and PICO question. But what I'd like to do is I'd like to do a very brief example of how to convert the PICO question into a search strategy using PubMed. So let's turn there together. So here I've gone to Emory University Health Science homepage. I've logged in through that homepage, selected PubMed as my database, and I've come to the Advanced Search tab on PubMed. And what I did is I took each element of the PICO question, the PICOT, and I converted that in each of those elements into a field in my advanced search. So among Medicare hospitals, discharge teaching or care plan, access readmission is my outcome and my timing is 2014. So you can run that search, and that provides a starting point for beginning to find the literature to answer your question, which is again the subsequent step after we create the PICO question. So let's run that search. So you can see that I have filters here from an earlier search, so I'm going to clear my filters. Now that search only revealed 2 articles, which are a fairly limited data set for creating a change process. So what I can do is I can go back and take out elements that I think are going to limit my search. So I've reduced it quite a bit to hospital, discharge teaching, care plan, and readmission. So let's run that search. So now I have 364 results, which is a much more robust set of articles that I can use to now begin narrowing my criteria to find the most useful and relevant ones for my problem. So we've looked at the first 3 steps of Melnick's model, which is what we'll do in this course. Come back for our next session, and I'll show you the rest of the model by way of overview.